Hi, Wally Taylor from Texas Integrative Wellness, and I want to answer a question today. What is stealth infection? For many years, when I was in medical school and for years after that, we were told that most of the parts of the body were sterile, such as the brain or the heart or the blood vessels or the tissues. There were only certain parts of the body that were thought to be having bacteria. Of course, our skin, our noses, our sinuses, our mouths, um, even the intestine throughout, especially the colon. But it turns out that because of new developments in the last 20 years or so, most of them related to our ability to evaluate the genome. Genes are the DNA and RNA that make up unique living organisms. It all started when we started to unravel the human DNA genome. And after this, we took the same technology and started applying it to the other living things in and around our bodies. It turns out that every living thing, whether it be a virus or a bacteria or a mold or fungus or yeast, a parasite, a worm, that all of these germs have their own types of unique DNA. And it turns out that now we are able to take specimens and look for the DNA and RNA in these organisms in our bodies, and then subsequently be able to name what's there. In the past, we had only been able to culture on plates in the laboratory many of these germs, and it turns out that when it comes to stealth infections, most of these germs are unable to be cultured. And so they were just basically thought to not be present. But now, with these newer techniques, where we've started to look at the brain and the blood and the tissues like the heart, the urine, the bladder, even the placenta, even the amniotic fluid, we're now finding with these new microbiological techniques that there's no part of our body that's actually sterile. And we're finding out that there's literally hundreds of different types of bacteria and other living things within these different areas of our bodies. The interesting thing is that many of these germs are actually thought to be good germs and actually contribute significantly to our health. But at the same time, we know that some of these germs cannot be so good and can end up causing disease. In fact, we know that sometimes good germs can act bad in certain situations. For example, if we have a very weakened or suppressed immune system, sometimes the good germs in our body can actually contribute to disease. But this is just a quick definition of stealth infection, why it's so critical today to understand that it's completely changing the paradigm of how we practice medicine relative to the presence of these germs in our body. So if you find this helpful, I'd invite you to subscribe to my video channel and share this video to friends and family. And I look forward to you coming back around to learn more about the way these environmental toxins, including germs and viruses, can contribute to your chronic ill health. And we just wish you a good health from head to toe. God bless.